Welcome to the Nurses Out Loud radio show. We will be starting in a few moments, so please stay tuned. If you are watching on social media, please give us a like, share, and follow. And for those of you who would like some more info, please go check us out at nursesoutloud.com. Thank you.
Every ER nurse knows this story. A parent rushes in at 2 a.m., terrified because their child has a fever, maybe 100.3, 100.9, 101, but they want answers. Test, Tylenol, something to make it stop. And we respond because we're trained to. Let's treat it. Let's bring it down. But what if what we've been taught to fear was just the body's own design of healing? In nursing school, we learn to treat symptoms, not always to understand them. A fever isn't the enemy. It's the body's way of fighting, of healing, of cleansing. Yet our culture turns every cough, rash, or fever into a medical emergency, and every child into a potential pharmaceutical customer. Today, we're talking to a pediatrician who has challenged that reflex for decades. He says true healing often looks like listening before intervening. That message might trigger some, but this show isn't about comfort. It's about truth. Dr. Lawrence Palevsky is a New York licensed board-certified pediatrician and past president of the American Holistic Medical Association. He's practiced across ER, ICU, NICU, inpatient and outpatient pediatrics, and now focuses on holistic integrative care for children and families. Before we dive in, I want to highly suggest you listen to one or two of Dr. Palevsky's interview at drpalevsky.com. His depth and clarity blew me away and left me wanting more. Because today's show will move fast. We're zeroing in on three things: when to go to the ER, his take on antibiotics, and his view on vaccines. I honestly wish I had hours with him. So if you want part two, comment your questions or email nursesoutloud@gmail.com. Dr. Palevsky, welcome to Nurses Out Loud.
Oh, thank you, Jodi. Thank you for that introduction, and thank you for inviting me to share some time with you.
Oh, I'm just so excited. I have been so excited ever since I was able to schedule with you. Because I work in the ER and we see it all the time. Parents bringing in their child, and as a triage nurse, I work that area a lot. It's an automatic COVID, flu, RSV test, maybe a chest x-ray, right? And a Tylenol or ibuprofen to bring the fever down. And so you say that fever is part of the body's cleansing process, that it's a friend and not a foe. Can you explain that in simple terms for parents who've been conditioned to panic?
Sure. I mean, what we're taught in medical school and what we're taught in the public eye is fever means infection. Mm-hmm. And so that's what parents walk away with. If my child has a fever, there must be an infection. But let's open the textbooks. What does the textbook say about fever? Fever can be caused by one of three things. 1, infection. 2, inflammation. And 3, neoplasm or cancer. And so for a child who has just an acute fever, the differential is fever gives you inflammation or infection. Now, the chemicals that cause us to have 102, 103, 104, 101 are active in the body to keep us at 98.6. So I'm going to say that again in another way. No one lives in an environment where it's always body temperature outside. So we live where it's 60, where it's 70, where it's 40, where it's 30, where it changes throughout the year. But our body temperature stays at 98.6. Why? Because our body uses the chemicals that cause fever to keep us at 98.6. So those chemicals are active all the time, day in, day out. If you are in a home where it's 70 degrees, those chemicals that give you 102 are keeping you at 98.6. They're just not working that hard. So you don't feel it, but they're working to keep you at 98.6. Now, there are ways in which material enters the body. Through the airway, through the mouth, on the skin, injections past the skin, coming at the nervous system, and the higher self, the spirit of the child, which is always receiving information. So those 6 ways, our children are actively receiving information. Newsflash. Some of that information is pure, and some of that information is impure. And the role of the body, if the body could speak, it would say, my role is to take pure material and make it work for the body and get rid of impure material at all costs. So how do we do that? We do that in 6 ways. We exhale. We pee. We poop. We sweat and smell. We sleep. So the nervous system rests and mobilizes impurities. And then the 6th way that we remove waste is through the immune system with the production of mucus. And so it's a balance of scales, Jodi. Impurities come in, they must go out. Pure material comes in, the body uses them, and then produces impure materials. Those must go out. So what is the body doing on a day-to-day basis? Balance of scales. And believe it or not, the chemicals that cause fever are fluctuating throughout the day because the amount of impure material that's being produced because we're using pure material, and then the amount of impure materials that are just entering have to be gathered, mobilized, and removed. And that material is going to cause inflammation. It just does. But we don't feel it. But there are fluctuations in those chemicals that cause our body temperature to stay 98.6, maybe 99, maybe 100, maybe 97, just to keep us balanced. But what happens if we go past threshold? What happens if we overload the body with impure material? What if the air that we're breathing, the things that we're putting in our mouth, the skincare products, the material we're injecting, the amount of information coming at our nervous system, and inability to stay connected to the higher self creates enough impurities that the body says, I can't. I just can't. So what does the body do? It gets sick. So the fever is going to have to go up to say, okay, we got to put a halt, timeout on material coming in. So what's the first thing kids do when they don't feel well? They stop eating. So they say, nope, no more. Don't put any more in my mouth. And what do they want to do? They want to rest and sleep. Don't put any more in my nervous system. While the body is mobilizing as many of the impurities as it can out to the surface. So a kid might have more mucus, just dripping out the nose, or coughing instead of exhaling, or sneezing instead of exhaling, or the kid's now vomiting, like, I got to get this crap out. Or there's now 3, 4, 5, 6 stools a day. Got to get this stuff out. Or there's rash. Or the kid just wants to sleep. Well, just leave me alone. Or the kid becomes very irritable because screaming and irritability are both ways for the nervous system to shake out the impurities. So the body is smart. And the reason I know this is because I just have to look in the autonomic nervous system, in the immune system, in the gastrointestinal system, in the pulmonary system, in the ENT system, in the dermatology system, in the neurological system, and the answers are all there, which are that the body has the innate ability to heal itself. And so we're just mobilizing impurities. We exhale, we pee, we poop, we sweat, we smell, we sleep, we rest, we may scream a little bit, and we produce mucus. And we're getting rid of impurities, no symptoms. But threshold is reached. You got to roll up the sleeves, the body says, and say, okay, I got to shut you down. And I got to burn this crap out. But it's not necessarily infection. It's just byproducts of material that come into the body that create inflammation, that are impure. And, unless you're a saint and everything you breathe is 100% pure and 100% everything you eat is 100% pure, everything you put on your skin is 100% pure, and everything you pull into your nervous system is 100% pure, and you're always aligned with your higher self, and you're always injecting material that's pure, you're going to produce impurities. And so your body's smart, and it says, get thee out. And if you're not going to let me get it out the normal ways, I'm going to get you sick. And I'm going to get you sick so that you stop putting more information in, so that no more impurities come in, and then I'm going to help you get the stuff out. So I don't want to suppress that. I want to comfort that, right? I want to get into bed with the kid, skin to skin, and connect. I want to turn off the lights. I want to slow down the food. I want to hydrate. I want to pull the plug is what I say. Do less, eat less, stimulate less, drink more, rest more, sleep more, hydrate more. Put the kid in a warm bath, put a cool cloth on the forehead, get into bed with them, turn out the lights, turn off the devices because that's a lot of stimulation, and chill. And guess what? Within a day or two, the body's back. But when you suppress with over-the-counter medicines, and when you suppress, and I know we'll get to talk about antibiotics in a second, what you basically do is you say to the body, okay, don't get rid of wastes. Don't get rid of impurities. My belief is that you have an infection and I don't like symptoms, and symptoms are bad, and we're taught to get rid of symptoms. Like you said, in nursing school, I was taught the same in medical school. And so what happens? The symptoms get better. And then the fever comes back a day later, even higher. Because why? Because the body says, heck no, I need to get this crap out. So I'm going to burn higher because you tried to stamp me out. Right? And so what happens? Instead of the fever going away after 3 days, now the fever goes away after 5 days. Because you prolonged the body's ability to burn out the impurities it needed to burn out. And so go ahead.
I was going to say, so in a sense, how I educate my patients is the fever is the body's response to like getting the army, and trying to fight something. And right. When we take, fever reducing medication, say, or even cough suppressant or, nasal decongestants, those kinds of things, we're telling the body, no, you don't really need to fight. We're gonna slow it down. And that's what, prolongs the illness. Right. My pediatrician, so I have two older kids, 18 years apart. And, in my youngest child, my pediatrician said, do not treat a fever. Like, I basically don't want you to treat it. And I was like, but give me a number. Like, at what number do I treat? And he's like, okay, fine. 104. Right. Nope. So, but that's, him telling me to make me feel better about cause we hear about seizures and stuff. What's your thoughts with all of that?
I don't care about the number on the thermometer. I care about what the child looks like. I'm a clinician, right? You as a nurse, if you're sitting at a nurse's station and you see on a monitor the patient goes flatline, most often you're trained to call a code. Like get the anesthesiologist, get the respiratory therapist, get everybody, because the patient just flatlined. What you're not taught is to walk into the room to check the patient, right? Yep. And when you walk in and all of a sudden the lead fell off, so the patient's sitting up eating lunch, and you call the code because the monitor said flatline, but the patient's fine. And that's how I feel about the thermometer. I don't care about the number. I want to know what the kid looks like. I want to know if they're awake, alert, arousable. Are they interactive? Are they looking at you? What's their eye contact? What's their head control? I want to know if they're talking, if they're urinating, how are they breathing? I want to know clinically. I'm a clinician. I was trained in the old dark days of good medicine, where we were taught how to assess patients. Nowadays, with protocol, AI, and algorithms, nobody knows how to assess a patient anymore. So if someone has abdominal pain, the surgery resident won't come to see the patient until the CAT scan and the sonogram are done. But why don't you examine the patient, right? Maybe it's psychological. Maybe the kid got hit, or maybe there's a kidney stone, or maybe there's constipation. But you'd know that by taking the history and doing the physical. So yes. I want to know what the kid looks like. And the very first time I went into private practice over 25 years ago, I would get a phone call from a parent. My kid has a fever. And my first response to the parent was, "Oh, good." And I've had parents tell me years later that I set them at ease because I wasn't worried. And now, certainly if the kid is below 2 months of age and has a fever, it's very different. If you have a child who's immunosuppressed and has a fever, it's very different. But if you're doing run-of-the-mill, regular pediatrics, and a kid has a fever, oh, good. Oh, good. And what I notice is that those kids who have constant fevers and symptoms, respiratory symptoms, and ENT symptoms, and ear symptoms, who get suppressed, those are the ones who develop chronic inflammatory conditions. Because chronic inflammatory conditions are merely failures of acute inflammatory conditions to resolve themselves. So when you suppress them with over-the-counter medicines and steroids and antibiotics and other pharmaceuticals, you end up keeping the waste materials, the impurities, in the body. And what happens to the body when inflammation increases? Cell function diminishes, tissue function diminishes, organ systems function diminish. And what you're left with is somewhere in the body, in each kid it's different, a chronic inflammatory condition. So we can really serve kids well by going back to the old but now new information, which is children get sick as life-saving mechanisms to make sure that they get well. That's simple. And all of the sciences of the body support that. It's right there in the textbooks that I was taught first year medical school, 1983.
Wow. So how do you educate your I'm assuming that we don't see a lot of your patients heading to the ER for a COVID flu RSV swab. Do you even care about that?
No. Well, for various reasons, but no.
Okay. Tell me why.
Because in my view, when I saw what COVID was, it wasn't an infectious problem. I did not in any way, shape, or form, and still to this day, do not agree with the assessment that anyone who got sick from an infection. Mm-hmm. Plus, the swab itself was a corrupt swab because it was based on spin cycles, and the hospital or the clinic would decide how many cycles to spin down and would artificially raise the number of cases just by spinning it down more than it should have been spun. But nonetheless, I still don't believe, and it's not just a believe, I think it's a fact, that COVID illness, if there was one, was not an infection. And if people say, well, then how did so many people get it? Because poisons can spread just as well as any other airborne problem.
Yep. I'm right there with you. That was one of the first things I was like, why? First of all, this is experimental. Second of all, there is no established cycle threshold. You know, that's like having pregnancy tests, all different, pregnancy tests. And we're like, oh, you're pregnant. Oh, no, wait, you're not. Yeah, yes, you are. All of these things. And I was like, I questioned it, and I educate my parents. I tell them, I said, okay, the doctor, do you want a COVID flu RSV swab? And they're like, most of the time now, which is really nice because that means people are, educating themselves, and they say no. And I said, well, just to let you know, the doctor's going to want it, but I'll tell you, there's really nothing any different that we're going to do. And I'm honest with them. It doesn't matter if it's positive. It does not change our course of treatment, truly.
Yeah. You know what's so funny about that, Jodi? First of all, the most common reason for flu has nothing to do with an infection either. It's what I just described about the body removing these excess impurities. And certainly at different times of year, you're going to be more vulnerable to getting sick because a day in December, regardless of where you live in the Northern Hemisphere, is not the same energetically as a day in July. And so the sunshine is different, the position of the sun is different, the position of the earth is different, and our adrenal reserves are different. And so it's summer in July, you have much more reserve. It's winter in December, you have fewer reserves. And if you're eating and sleeping the same in July as you were in December, you're more likely to get sick because you need to slow down as the days get shorter, unless you live on the equator, in which case the days never get shorter. But most people don't live on the equator. So even in the cycles of fewer weather cycles, like if you're living closer in the south of the United States, there's still changes in the season. And that's still going to affect your body. And how you eat and how you sleep and how you behave changes your body's health, especially if your reserves are different at different times of the year. So your body must get sick if you overload it. Body must get sick if what's most September, October, November, December in the United States? Sugar season. What's happening to the days? They're getting shorter. What does that mean if the days are getting shorter? Your body's adrenal reserves are lowering. So you're overloading with sugar at a time when your adrenal reserves are lowering, your vitamin D exposure is lower, you're probably not sleeping as much as you need to. And so same thing in the balance of scales. You create an imbalance and your body says, heck, I can't tolerate this. I got to get you sick to stop this over threshold. And it's that simple. And the other thing is that what if somebody comes back positive for COVID, positive for flu, and positive for RSV? What are you going to do?
Mm-hmm. The same thing we would have normally done. Symptoms, treat the symptoms. Yeah.
Right, but we don't treat symptoms anymore. We treat lab values.
Yes.
So when I've had families where they did go to the ER or urgent care and the kid had a nasal swab and it came back positive for 3 different viruses. So I said to the family, what did the doctor tell you your child had? No answer. Like, what's the value of doing the swab? So now you have 3 illnesses. You have 3 illnesses? No, you don't. No, you don't. You don't have 1 infection, let alone 3 infections. Your body's getting sick because it needs to get sick, because in its environment, it went past threshold and your body needed to remove the impurities. Very simple.
Yeah.
Very.
And like you said, this is a time of year where, it's sugar season, right? And that creates an inflammatory response in the body. So you have that, and then shorter days. So like shorter sunlight, shorter energy from the sun, right? You're talking about the adrenal reserve with that.
Mm-hmm.
Yep.
Mm-hmm.
And okay. Oh my gosh, I have so many things I want to talk to you about. We're going to get to it. We will. I wish I had a Joe Rogan style podcast where I could keep you on for 3 hours.
Oh, okay.
But we will. We're continuing. We got to take a quick break here, guys. I encourage you, whatever platform you're listening to us on, subscribe, like, and share so you don't miss anything. And we're staying connected. You boost us up in the feed. If you go to substack.com and search for Nurses Out Loud, you will get daily drops of our shows, because we are on air here 5 days a week. We're on the America Out Loud Talk Radio Network. You can download that app. You can listen to us on Rumble. You can also find us on Apple Podcasts, Spotify, all of the above. And if you have any questions for us, please send us an email to nursesoutloud@gmail.com. And any questions for Dr. Palevsky, again, go to drpalevsky.com. You have homework. Okay. You have got to educate yourself. I'm telling you, for me, I mean, my eyes were wide open in 2020, and I have spent the last 5 years educating myself. And as a nurse who really cares about my license, I need to make sure that what I speak on is, has some backing, right? And that's why you hear me. I talk about ethics, and I talk about things that I learn. And as nurses, we are called to do that. And so we'll be right back after the break.
If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreibfetter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com.
All right, guys. Thank you. You are listening to Nurses Out Loud, and I'm your host, Nurse Jodi O'Malley. I have here with me Dr. Palevsky, a pediatrician out of New York, and we are going to hit 3 things on this next half of the show. We already talked about when to go to the ER. We're going to talk about antibiotics, when they're truly indicated, and the cost of reflex prescribing, because that's what we do. You guys show up to the emergency room and you're not comfortable with saying you have a virus, or, your body is fighting something. You always want a prescription for the most part. Okay. So we're going to get into that. And then we are going to talk about vaccines and informed consent. And so, yeah. Okay, so let's see. Do we want to talk? Okay, glutathione. Give me your thoughts on glutathione. I just learned about glutathione the last few years, and now that's in the news again. What's your thoughts on glutathione?
So,
And
glutathione
Tylenol,
is
I should say.
acetaminophen. I'll talk about.
Yes.
What we learn in medical school is that there's a chemical that's produced in every cell of the body called glutathione. And glutathione is made up of 3 amino acids: glutamine, glycine, and cysteine. And the body requires those amino acids. And now, what is the function of glutathione? It's very heavily embedded in the gut and in the liver and in the brain. So what is the purpose of that chemical in the body? It cleans the body out. Mm-hmm. It helps the body detoxify. It helps the body remove impurities. It helps the body remove heavy metals. It acts as an antioxidant. And so when you're sick with acute symptoms, you need your glutathione more than any other time. And if you give the body acetaminophen in any form, you basically tell the body, I'm going to take your glutathione away from you so that you can't detoxify while you're sick. Because acetaminophen is a toxic chemical when it's broken down by the liver. And the second to last chemical is a chemical that will destroy liver cells and brain cells. Mm-hmm. And the thing that prevents the liver and the brain from being destroyed by this byproduct of breakdown of acetaminophen is glutathione. And so essentially, when you're sick and you need your glutathione to detoxify, to cleanse, to remove the wastes, to get rid of metals, to get rid of toxins, to act as an antioxidant, here comes along acetaminophen and says, no, come over here. We need you so we don't chew up the liver. And then what's left at the site is not enough glutathione. So what happens? Your impurities build up. Mm-hmm. And you stay sick. And so it's literally an example of taking from Peter and giving to Paul. And so you feel triumphant. Yeah, I got rid of the fever. I got rid of the pain. I got rid of the inflammation. But no, you didn't. You got rid of the symptoms, but you actually increased inflammation by stopping the body's glutathione stores because you pulled them away from where the body needed it because you had too many impurities that needed to be removed. Mm-hmm. And I remember I was an ER doc from 1991 to 1995 in the Bronx in New York. And then I ran a pediatric intensive care unit from 95 to 2000 in Manhattan, where I also covered the ER. And I remember back then saying to parents, acetaminophen is not the greatest drug to be using for your child. And so what is the product that we use if someone overdoses on acetaminophen? It's called Mucomyst. Mm-hmm. What is Mucomyst? N-acetylcysteine.
Mm-hmm.
Cysteine, which is one of the 3 amino acids that helps you make glutathione. So what you're basically doing when you take acetaminophen and then take cysteine is you're robbing and replenishing. You're robbing and replenishing. So that's like burning your skin and putting more aloe, and burning your skin and putting more aloe, and burning more skin and putting more aloe. Well, don't burn your skin. Mm-hmm. So that's my take. And so acetaminophen is not a safe drug. And if you look at the older literature from the American Academy of Pediatrics, but more specifically from the American College of Obstetrics and Gynecology, they all said, go carefully giving acetaminophen during pregnancy.
Mm-hmm.
And now that HHS and the White House have both made a statement about acetaminophen, the American College of OBGYN and the American Academy of Pediatrics have doubled down and said, no, it's safe.
Mm-hmm.
And so they have literally gone the other direction from what their previous publications indicated. And yet they've not come out with any studies to demonstrate that their reversal on these positions is actually backed by good science. And what's interesting even more, Jodi, is that when you look at all of the information that describes the use of acetaminophen during pregnancy and its association with neurodevelopmental disabilities in children, it came out of Harvard, it came out of Johns Hopkins, it came out of Mount Sinai. These are prestigious places. And so, if one study were a problem, but they found 100 studies that demonstrated that the use of acetaminophen during pregnancy can increase the percentages of children who develop neurodevelopmental disabilities. So you got to get past all of this, media stuff and, the women who went on TikTok and decided, they were going to show President Trump how acetaminophen is not dangerous during pregnancy. And then you hear these reports of these women who died, never recovered, because they overdosed on acetaminophen while pregnant. Now, again, I don't know if those stories are true because they were reported on social media.
Yeah.
But I wouldn't be surprised.
Right. We have a lot of patients, pregnant patients that have heard, right? And, the doctor, they love, oh my goodness, 1,000 milligrams IV Tylenol is their favorite, over to treat pain. And since being back in the ER, I, ask the patient, what's your pain? And, they'll give me a number and I say, okay, because the doctor ordered to IV Tylenol for you. And do you want it? And, a lot of times they say yes. And I say, have you talked to your pediatrician or your OB? What does your OB tell you? I said, because, my OB didn't want me taking Tylenol 30 years ago. And they're like, oh, well, I've never had that conversation.
Correct.
And I said, well, they do tell us like, don't eat lunch meat, don't, change the cat litter box. And they're like, yeah, I know all of that. And I say, okay, so I'm just asking you, are you okay with your pain being a 6 or 7? Because we can certainly treat you if you want. And I tell you, that little bit of education to them gives them, they pause for thought and they say, you know what, I'm okay. And I say, okay, well, just to let you know, if you need it, it's here. But I'm just telling you. And so I say that, and I want to let nurses know that just because a doctor ordered something does not mean you don't provide education to the patient. It's in our code of ethics that patients deserve all the information. So if you have information, you need to inform them so they can properly consent. That is your role, right, as a nurse. So
what you just described, Jodi, is what's missing in medicine, which is informed consent. And you also described what is pervasive in our culture, which is a moral judgment on symptoms. In other words, if symptoms occur, they're bad. I'm morally judging them as bad, and you should not have symptoms. And what the science of the body teaches us is that the expression of symptoms is actually information the body is trying to give you about what it needs you to pay attention to. And so that is not rocket science. That is actually described in the medical textbooks. It's just not applied when people are taught in medical school, and then when people go out into practice and apply what they were taught. And so, it's not necessary to treat all symptoms. And in fact, sometimes if you can find ways to support the body's need to express the symptoms, and sometimes if you can offer remedies that don't suppress, you will actually resolve your symptoms much quicker and in a much healthier way for what your body needs. Because your body had those symptoms for a reason, and it wasn't to tell you that something's bad. It was to tell you that, pay attention, you need to listen.
So let's take the person who is uncontrollable vomiting, for example. Okay. At what point, would you say, like, if you can replace orally, at home, the fluids that you're expelling, to try to maintain, a proper fluid balance, then would you, like, at that point say that, okay, you don't need an emetic at that, you know what I mean?
Right.
Does that make sense? Or like having diarrhea, if you're able to, replace the fluids orally to compensate, because you don't want to get dehydrated. So at what point would you say we need to stop this?
Right. Well, it's different for children than adults, because children who get dehydrated will collapse faster than adults, because so you have to be very careful with kids, especially if they develop ketones, because the elevation in the ketones will bring on more of the vomiting and more of the diarrhea, and then the cycle just spins. But most of the time, I have been able, as a pediatrician with my practice, to support the kids when possible to start small sips of hydration. And as soon as I start the small sips of hydration, sometimes every 10 minutes, every 15 minutes, and as soon as it becomes clear that sips of broth or tea are being kept down, then we start to increase it. I stay away from food completely, and I make sure that just warm fluids, not juices, not milks, not smoothies, not shakes, warm fluids, because you want to give the body almost body temperature, so that there's no gradient of stress. And you just small sips, and little by little, you allow the kid to sleep. There are ways to check for dehydration, breathing pattern, lips, sunken eyes, urine output, turgor. I'll even teach parents, pinch the end of the finger. How long does it take for it to get red again? This is stuff parents can learn, and they do learn. And I will do my best to prevent the dehydration from worsening. If it's a kid that's in the emergency room or in the hospital, there's no reason for medication, because as soon as you hydrate that person, the ketones will go away. And unless you're in diabetic ketoacidosis, but the ketones will go away. And once the ketones go away, the vomiting and the diarrhea should stop, because the ketones can add to the vomiting and the diarrhea. And once you clear them with IV fluids, you don't need medication. And there are essential oils that can help, and there are herbal teas that can help to settle the stomach. Chamomile, peppermint tea. These are very easy. Even licorice tea is an amazing settler of the stomach. And so it's not rocket science. You don't have to use Zofran or some other antiemetic because you don't like vomiting. Well, actually, the body needs to vomit because something needs to get out.
Yeah, Right. It's a symptom. And I think you explained that very, very well on the first part of the show. Guys, you got to go to drpalevsky.com. That is drpalevsky.com, because he has a resource for you. All of the things that he's talking about right now is literally laid out there so beautifully. I give ever since I found your website, now I give it as a resource. I write it on the discharge papers. So I just love it. Yes, I love it. So, okay. So we only have a few more minutes here, probably about 15. So, antibiotics. I read on your website that you write maybe one antibiotic prescription a year. Wow.
Maybe.
Yeah. What? Talk about that. That's crazy.
Well, again, it goes back to what I said earlier in our discussion. Most illnesses in children are meant to be cleansing of impurities. So again, you'll see that there are some people who will say there's no such thing as contagion. And I actually believe the opposite. I think every second of every day we are contagious because the air is constantly filled with microorganisms and other things.
Yeah.
Right? And if you breathe in the air and you exhale your air and you're near somebody, you're contagious. We don't teach people that the skin is filled with microorganisms. Filled. I mean, like trillions of them. Or the vaginal canal in women, or the mouth and nose of all of us. And so any contact with other people equals constant contagiousness. So we're never not exposed to germs. And there's never a moment in our life where there isn't contagiousness, because the air in which we live is filled with germs. So contagiousness is a constant. So what you'll hear from parents is, oh, there's a bug going around. And my answer is, there's never not a bug going around. And so when you realize that we're making stuff up, this mythological bug going around, we then understand that when we get sick, we're actually getting sick because our body was poisoned with too many impurities that must be removed at all costs. So getting sick, mucus production, getting sick are all mechanisms that are life-saving to clean the body out. And so if you were to teach people, which I do, why do we have over 100 trillion microorganisms lining the nose to the lungs, the mouth to the anus, all over the skin, and the women's reproductive system? Why are they there? Did you know they're there? Why are they there?
Yeah.
And people look at me like, I don't know. I say, well, they're there to protect you. They're there to help digest your food. They're there to produce certain vitamins for your body's health. They're there to interact with your immune system. And they're there to clean you out. So when you're sick, why do they all of a sudden take on an infectious role? Why are they not working overtime with the mucus that's there to enhance your body's removal of impurities? And people look at me like I just twisted their head 270 degrees, because that's how I understand the body to work. That's how I understand why there's microorganisms in the first place. And so we have more than 100, 200, maybe 400 trillion bugs in our body all the time. And you're telling me that when you're well, you don't have any germs that make you sick? You only get sick when a germ comes into you that you never saw before. Oh, come on. Cinderella's a better story than that one.
Right. That's great. I mean, you're really, I think it's the epitome of that phrase, like when you know better, you do better, you know? And just the way you beautifully explain this, I'm sure that everybody can relate and understand. So thank you for doing that.
Sure.
Okay, let's move on to a big topic, vaccines. I have listened to a couple of your podcasts that you have on your website. Again, guys, drpalevsky.com. Go listen, because we don't have time to get into the adjuvants that are in there and how he describes, like, you know, some of the adjuvants that are in the vaccine are actually in chemotherapy drugs, so that they do cross the blood-brain barrier, so that the chemotherapy drug can work and cause inflammation, all of this stuff. Okay. But I want to talk about, briefly, because I have a few questions, and maybe I'll just throw them out there to you. You're practicing in New York. I mean, that's arguably one of the toughest states for vaccine freedom. How do you navigate that with your parents? You know, do you have a lot of parents that want them? How do you have that discussion? Because again, when I said, when you know better, you do better. So talk about that.
So in 1998, I was given a statement by a parent in my practice. Dr. Larry, did you know that there's mercury in vaccines? Now, this is 15 years after I started medical school in 1983. And I said, no, I am not aware that there's mercury in vaccines. And so I just opened up the package inserts and said, okay, what else is in here? And I went on a mad dash to learn about the pharmacological properties of many of those chemicals. And what I realized was, when I looked at those pharmacological properties and then looked to see if there were any studies in the scientific literature explaining what happens when those chemicals are injected into the body through vaccines, I saw nothing. Mm. And so I was trained in medicine to basically practice the Hippocratic Oath, the precautionary principle. First, do no harm. And that's what I abide by. First, do no harm. So if I know that something has the potential to cause damage in the literature based on what is written about the chemical, and we have no literature to explain its injection into the human child, then I can't abide by it. Mm-hmm. And so by 1998, I stopped on a dime and started seeing patients in a clinic that I was seeing patients in, affiliated with the hospital where I was working. And I was willing to delay or even not give until we had more information. Word got out in New York about this doctor associated with this hospital and a clinic, and I got a mad dash of new patients. In 2000, I started working in an integrative medical center affiliated with Beth Israel in New York. And the practice sold vaccines, but I started getting many, many patients who wanted to not give their kids vaccines. And my job was to give informed consent. And so remember, the model of medicine is do what I'm telling you or else.
Yep.
The other side of the model of medicine is don't do this or else. And I don't practice that way. What I practice with is I'm going to inform you. I'm going to educate you. I'm going to empower you. I'm going to give you as much information as I can so that you, as the individual who have to live your life, who are in charge of your kid, are in a best place to make the best decision that you can. And that's what I did. And in 2002, when I left that practice, I never sold these shots again in my office. So I made the choice to no longer sell these injections. So if parents in my practice want them, I don't stop them. I give them informed consent and I say, now go do what you feel best. And they want them, they get them. And that's okay. I'm not going to judge them for it. And then most of the patients in my practice are patients who are not injected.
So I should be ending right now, but I need to ask you a question. You said you don't sell vaccines in your clinic.
Correct.
Or you decided not to start selling them. I thought that was a pretty that was a poignant statement, because a lot of people are learning, with their pediatricians, to say that they stop seeing patients if they don't vaccinate. And
Correct.
there was this whole talk about, they get paid based on the percentage, their payment goes up the higher the percentage of their vaccination. This is true, right? This is true?
Yeah, I didn't learn about that until after I stopped using them in my office. I was not aware because, I didn't even think about it. But to find out that you as a pediatrician are basing your policies with your patients on whether or not you can get a bonus from an insurance company, that's not medical care anymore at all. That's praying to the almighty dollar and the almighty papal ring. And so my devotion is to patient care. And I give advice, I make known what I think is best for the child, and I say to the parent, if you choose to do this, this is how I would do it.
Yeah. Wow. I wish we had hours with you. Guys, if you want a part 2, tell me what you want me to ask Dr. Palevsky next, and I'll do my best to bring him back to hear more about from Dr. Palevsky. Again, visit drpalevsky.com and check out his podcast, Critically Thinking with Dr. T and Dr. P. Did I get that right?
Perfect.
Yeah, perfect. And while you're on your research journey, go grab the book Vaccines Amen by Aaron Siri. Okay, this dives into how vaccine policy became a belief system instead of science. And don't forget to subscribe to substack.com /@ Nurses Out Loud for daily drops of our shows, so you never miss an episode. This is about informed consent, guys, integrity and courage to question what we've been told. And I'm Jodi O'Malley, and this is Nurses Out Loud. And until next time, friends, be safe, be well, and God bless. Thank you, Doctor.
Thank you.
Shining light into darkness, thank you for tuning in to Nurses Out Loud.